Howdy, welcome back to East Texas Now. My name's Hannah Johnson, and I have a friend joining me here to talk about something that is really becoming a much-needed help for folks in East Texas. We have our very own Emma Burns talking about this new groundbreaking for CHRISTUS, is that right, in Jacksonville?
CHRISTUS Mother Francis in Jacksonville. So they held a groundbreaking ceremony this morning. If you've already taken a peek, we have an article up there rubbing that purple sand. It's about to pull it up, but you might have to backtrack it.
Oh,
Here. Did you get it? No, I think you got it up. Look, ready? Boop. That is like the moment right there. So yes, they broke ground this morning on a major expansion for their hospital. So that pain management center you see right there will not be the pain center anymore. So this new 30,000 square foot facility will be focusing on providing specialized care in orthopedics, pain management, and vascular services. Now, something really important that I took away from this event this morning was, it's cool, we're bringing more healthcare to East Texas, but more specifically rural East Texas. I was able to speak with one of the physicians who is the current director of the pain management center that they have in Jacksonville, and one of his passions is being able to bring, in his words, big city healthcare to small towns. So here in East Texas, providing good quality specialized healthcare for people who need it. Because if you're in pain, or if anybody already is familiar with Dr. Serrani, if he's one of your physicians and you're in pain and you don't want to travel all the way to Dallas, you know that you can get that specialized care here in East Texas. Or maybe you live in deep East Texas and you don't want to drive all the way to, let's say, like Tyler or Longview. This would be a great opportunity for everybody to receive some healthcare.
And we were talking just moments ago before we got into the story about how, you don't want to add on those extra layers of pain or the financial burden of having to travel to those big city areas to get the treatment and the care that you need. This is taking away some of those extra burdens, that long drive or that uncomfortable setting or just having to wait longer or even just the financial aspect.
Right. And even on top of this, another positive and another reason why they're having to expand is because so many people are getting that good quality care. They need more room for it. So this is the opportunity. So like I said, I spoke with Dr. Serrani, and he said that this is a dream that he has been pushing for 14 years to get rolling, and it's now time.
We're taking care of this community, but this community expanded to the state of Texas and the country. So we now have patients coming from everywhere, beyond just our community. So we've incorporated interventional pain now with vascular surgery and orthopedics with a strategy that when patients present with one certain symptom, let's say it's leg pain or back pain, it could be any of those specialties, but the presenting symptoms we are triaging, assessing in a certain way, all with a certain humility and compassionate culture. Big city medicine doesn't always have to be practiced in big cities. You can deliver big city medicine in small towns. The people in rural towns are amazing people, and they hurt and have the conditions that everybody else does. What happened here in Jacksonville, we delivered that care in such a way people started to talk about it, and the message spread. So now you have what we have here today, an expansion of a interventional advanced specialty center in a small town. But we don't have that small town feel anymore, because the parking lot, it needs to be enlarged. The building needs to be enlarged. Everything needs to be enlarged, and that's what we're doing here today. But we are focused on delivering a certain level of care with compassion, humility, understanding, and I think that's what patients want. And so it's obvious, based on their word of mouth, it was something that they shared with their loved ones, and then their loved ones came the next week, and then so on and so on and so on. The thing that seals it for me, this was a dream. 14 years ago, this was a vision. And for me personally, I saw the vision and it was tangible, and I was convincing everybody else. Because when you say I want to build a big, advanced subspecialty, super specialty center in a rural town, sometimes that's a hard sell. So what's most important for me personally is that people saw the vision, understood the vision, and today was a testimony that everyone gets it. And so on a personal note, it's a very special day. And on top of that, I don't know if you know, I practice medicine with my son as my partner, and that's a daily blessing. So there's a couple huge personal feelings for me today, in that A, we're about to break ground on this vision from 14 years ago, and B, I'm doing it with my son, who, you know, when we're gone, it'll be here. So it's all about legacy. We're building a legacy for Jacksonville. It's also about a personal legacy and legacy for my partners and colleagues that we've established relationships with from years ago when we first sat down and manifested this dream. This, when it's done, will be one of the most advanced interventional specialty centers in the state. Yeah, it's that special, it's that big. There'll be 8 interventional rooms to be utilized by interventional pain, vascular surgery, and orthopedics. There'll be a freestanding 24 exam room clinic standing right where we are right now in about 15 to 17 months. It'll change the face of the community, and it'll give the community even more pride, and more patients will come. I've often said, and I truly believe, CHRISTUS Trinity Mother Francis Jacksonville is built on hallowed ground. So as you can see behind me, everything that's planted here, every seed that's planted here, the challenge comes in handling the growth. So you got to be careful. Whatever you plant here is going to grow, whether it be physical therapy, whether it be interventional pain, whether it be the emergency department. So we're blessed with this challenge. So I'm excited that everybody's rising to meet the challenge, and we're very excited about the future.
Well, you can definitely hear the passion in his voice, and the sweet, I mean, you just can't help but connect with him about wanting to leave a legacy, not just for, of course, Jacksonville, but mentioning that he works with his son and how it's a legacy for their family. Right. That's huge.
And then even like earlier, I was saying they're growing and growing and growing. He touched on that. It's like you're planting a seed, and this place is just going to boom. Let's say like 50 years down the road. We don't know what healthcare is going to look like here in East Texas. It might just be all over amazing. So this was really great. So this expansion, they broke ground today. They're going to go ahead and start doing all the groundwork to prep it, and then construction is expected to begin in the next few weeks, so early in the new year, and then it'll take about 18 months to be complete.
Right, because they want everything to be perfect.
Everything perfect.
You know, cross those T's, dot those I's.
Right, so there's be like there's 24 new exam rooms. It's going to be like full service, like imaging. It's going to be a very expansive and extensive expansion. So this is a really, really great thing for East Texas.
Now, if you would like to hear more and, you know, check in with all these dates, we're going to do our best to continue and follow along with those updates, but find them at kltv.com, kcherry.com.
Yep.
Thank you.